So it's just like doing something like that. Get around, moving around, around. So my the caption everybody.
Then back to your
Yeah, I'm back to me again. Then you get your yeah.
go around
So and then. But great, this has given me my life back. A testimony, outcome measure, subjective. Since using the ODFX, I no longer use my walking stick. I also feel more confident when using the ODFX. Giving the ownership of this thing back to the patient and saying you can manage yourself, you don't always need me all the time. You know, we'll see part of this in that, well, we know this one, how electrical simulation works. I won't go too much into most of all those things. The positive advantage of this is that, say, using this kind of thing, if you are to be, we've treated strokes for years, donkeys of years. And before you can even get somebody, you know, from the acute stage, you know, to, you know, going out, say, in the Western world, everywhere is paved. It's very easy for people to walk around. Just look outside from there. It doesn't take somebody, you know, we live a very hard life here, but we can still make that, even though we are poor, we can make life a bit easier for our patients. You know, if we can find something that will make life a bit easier, one, you're giving them the ownership, they can manage themselves. It saves you the time to see more patients. Yes. So that is one thing, you know, to look at, to think about. Okay, who can use functional electrical simulation? Now, very important, stroke, MS, incomplete, spinal cord injury, above T12. Upper motor neuron lesions, very important. Bear that in mind during question time. If you ask me a question about peripheral nerve injury and things like that, it's outside the remit of this. Or before I take next question, that's a very important question. Carryover effect, that's what you're asking me there. How much of carryover effect does this device have? One, it's, like I mentioned it earlier, it doesn't work for everybody. It's not a miracle kind of device that, okay, somebody, that's another very tricky question somebody asked me in LUTH. It's not a one-off thing that this device is not for your clinic. Basically, that's what it is. It is not for you to have in your clinic and use it just for the moment, and then as the patient walks out, the effect of it will continue. No. It is for the patient, to empower the patient. An average person that needs the machine will always need it. And once they use it and it works for them, they will depend on it. This one is a dynamic splinting. All right? So the muscle, you are still using the same set of muscle, and over time, they begin to strengthen the muscle. And I have a patient at the moment, I've withdrawn it from her, she's great. She's delighted with herself, fine. But it took about 2 years, she fell within that category, fine. And the other thing I want to say is that, the theory says it's for upper motor neuron lesion. I have a patient with MND. In 2010, September, she was referred to me. I went to see her. Then the major problem she has is that, oh, I'm falling. I think that was the beginning of her trouble. And after some time, they said, I heard about something, that there's a machine, you know, that can help you to walk properly, that they use it for stroke and MS. Now, why can I not try it? I gave her a go. Fine. 2 years. She was able to walk effectively for 2 years. But in the last, in fact, as at now, you know, she's one of my closest friends now. So we'll be so great. But she's lost so much function now that she cannot walk anymore. But look, she's eternally grateful that she made all the trouble. It worked all the while.
But in this environment, do you have any research that's been done? Or is being done presently?
Thank you very much. That's a very good question. That is one of the major reasons. Please, thank you so much. This is one of the major reasons why I was thinking, and sincerely, there's no research at all in Africa. So Professor Way, you know, he latched on to that. as regards the use of the device, I would really love it if people can take on